Hey everyone, we are continuing chapter 9, Articulations, Joints, starting on slide 17. We've talked about different types of joints, then we focused on synovial joints. Here we're focusing on a very specific synovial joint, the tibio patellofemoral joint. It's a mouthful. Tibio, because it involves the tibia, patello, because it involves the patella, femoral, because it involves the femur. Hence tibio patellofemoral joint. That is our fancy way of saying the knee joint. It is a compound joint, meaning more than two bones come together to form a joint. There are 3 bones then. It does not include the fibula. No fibula at the knee joint. The fibula, if you're curious, does articulate with the tibia, but it does not articulate with the patella or femur. So it is not part of the knee joint, the tibio patellofemoral joint. Some interesting features of the tibio patellofemoral joint. You can lock your knee because of these condyles of the tibia fitting well with the condyles of the femur, fitting well in that intercondylar notch, this part here. And that can help stabilize your knee joint. And if you contract your muscles, that helps unlock them. I hear that if you've done things like marching band, you're probably told to not lock your knees because that can cause blood to fall away from your head and therefore you can faint. So we'll be talking about specific structures of the knee. Not every single part of the knee, but some important parts. Specifically, let's talk about the important cartilages and ligaments of the knee. We've mentioned menisci before. There are 2 of them in each knee. There's a medial meniscus, and if we're looking from a posterior view, the medial meniscus is medial. Sorry, this is the left knee, so this would be medial. And then the lateral meniscus would be lateral, if we're looking in the posterior view of the left knee. Here's the lateral meniscus. If you look from a superior view, we're looking at the right knee in this picture, right knee superior view. Lateral meniscus is over here. Medial meniscus is over here. They form this kind of C shape. And so they're kind of creating this platform, this cup for the condyles of the femur to fit in nicely and get cushioned by them. You will, of course, have fat pads. You have bursae helping reduce friction between the patella and other tissues. And you can see locations of different bursae here. I'm not going to ask you to know the names of all the different bursae or the fat pads, but they're there surrounding the joint capsule. But within the joint capsule, actually separating the joint capsule, you have those menisci, the medial and lateral menisci, made of fibrocartilage. The ligaments of the knee, there are 1, 2, 3, 4, 5, 6. 6 that I'd like you to know, and then actually it might be 7. 7 that I'd like you to know, and then 1 ligament. Yeah. Sorry. Okay, here we are, slide 19. If you take a look at this picture, whoops, slide 19, take a look at this picture on the top right. You can see we're looking at the right knee from the anterior kind of lateral view. Here's the patella. Here's the fibula, here's the tibia. The first 2 ligaments that I want to point out are the medial, which is actually kind of hiding. The medial collateral ligament is hiding on this side. And then more visibly, you can see the lateral collateral ligament. The medial collateral ligament is connecting the medial epicondyle of the femur to the tibia. The lateral collateral ligament is connecting the lateral epicondyle of the femur to the fibula. So you might see them called tibial collateral and fibular collateral ligament. It's the same thing. I'm going to go with side, medial collateral and lateral collateral. The word collateral, like the word lateral, means off to the side. So collateral is connecting off to the side. on the medial side, and then lateral collateral is on the lateral side. You're bracing horizontal movements. The knee, the tibio-patellofemoral joint, is not supposed to have a side-to-side movement. You're limiting that movement with these ligaments. On the posterior side, you want to limit movement posteriorly. So take a look at this picture down here. We have a ligament that's crossing over this way and this way. Where I just made my pink markings, it's on the back of the knee. The term for back of the knee is popliteal. These two together are known as the popliteal ligaments. So we've talked about four now: medial collateral, lateral collateral, and two popliteal ligaments that are crossing in the back. They connect the femur to the head of the tibia and the head of the fibula, stabilizing the posterior side of the knee. So we've stabilized the lateral sides, well, either side of the knee, medial and lateral sides of the knee. We've stabilized the posterior side of the knee. We still have to stabilize the anterior side, and we want to prevent back forth movement as well. So we want to stabilize somehow prevent backward, forward, anterior, posterior movement, what we call drawer movement, because a drawer can move back and forth. To prevent that drawer movement, to prevent anterior, posterior movement, we need two ligaments. This first one is called the anterior cruciate ligament. I'm going to color it right here. It connects from the tibia, the anterior part of the tibia, and goes a bit more posterior to the intercondylar fossa of the femur, the kind of middle posterior side of the distal side of the femur. That's the anterior cruciate ligament. So anterior is referring to the tibia. Anterior is because it's attached to the anterior side of the tibia. It actually goes posteriorly on the femur. The posterior cruciate ligament connects to the posterior side of the tibia and then comes more anteriorly on the femur. So it's hiding back here and then comes a bit more anteriorly. When you look at them from a lateral view, they're actually going to cross a little bit. Here's my attempt to draw it. It's not to scale, but they form a cross. The word cruciate means cross. That's why they're called cruciate ligaments, because they cross each other. And by crossing from the anterior to posterior side, posterior to anterior side, they prevent forward movement and backward movement. They're preventing movement in that drawer motion. These ligaments you may be familiar with because in many sports, when you twist, you can tear these ligaments. Twisting motions, these ligaments do not. They're not made for. They're made for those back forward movements to limit, but twisting movements can tear them. We've talked about how dense regular connective tissue, which ligaments are made of, are really strong in one direction. These ligaments are really strong in that anterior posterior plane. They're not strong in that lateral twisting plane. Finally, on the anterior side, we have one large ligament. This is the patellar ligament. It connects the patella to the tibial tuberosity. It's a ligament because it connects from patella, bone, to tibia, bone. It's colloquially known as the patellar tendon. This is a misnomer. It is not a tendon. It's often called that, though, because the patellar ligament is continuous with a tendon. It's continuous with the quadriceps tendon, also known as the rectus femoris tendon, which we'll go over that muscle coming up. You might know this as the thing that you hit when you're doing that knee-jerk reflex. You hit the patellar ligament, which actually stretches the quadriceps tendon, which instigates this knee-jerk reflex. We're going to go over that reflex coming up. But to recap, we've gone over several ligaments. Actually, let me recap this with complete anatomy. If you go to our videos page, articulations and movements, go to skeletal systems and articulations. And click on that link. It might say view screen mode. Click on the, not the very top right X, but the X under view screen mode. So I'm going to click on that X and click on keep current model position. Choose the screen. And now I can explore here on this left knee. On this left knee, this still has the joint capsule. But you can see the quadriceps tendon. And the patellar ligament. On the right side, we've removed the joint capsule and the quadriceps so that we can see the ligaments. So let's clear this and take a closer look on the right side. From an anterior view, you can see the patellar ligament. You can see the medial collateral ligament and the lateral collateral ligament. If I rotate a little bit, you can see how the medial collateral ligament is just going straight up and down. If I rotate to the other way, you can see how the lateral collateral ligament is also going straight up and down on the lateral side. All right, so those are 3 ligaments so far. Clearing this, we can go to the posterior side, the popliteal side, and we can see our popliteal ligaments. Here is one popliteal ligament, don't worry about the specific name, and then here is the other popliteal ligament. They also form a cross, sort of crossing over on the posterior side. They're bracing the posterior side of the knee. If I remove the femur so that we can see, maybe I can fade it, that'd be better. If I fade the femur, we can see a ligament that connects on the anterior side of the tibia and then goes posterior on the femur. This is the anterior cruciate ligament. Starts on the anterior tibia, goes posterior. Prevents the knee from going too far back. Looking from a different angle. Popliteal ligaments are in the way. There we go. All right, let me color in the anterior cruciate ligament again. There's the anterior cruciate. The posterior cruciate connects down here and up to here. That's the posterior cruciate. Ligament. What you can also see from this view of the faded, through the faded femur, you can see the menisci. you can see the medial meniscus, and the lateral meniscus. So 2 ligaments in the back, 2 ligaments on the side, 1 ligament in front, 2 in between. So, and 7 ligaments plus 2 menisci in each knee that I'd like you to know. There are more ligaments than this. I'd just like you to focus on these since we're covering all the major sides of the knee and going back and forth. All right. So we have one more video coming up for articulations where we'll talk about movements. So I'll see you in the next video. Please let me know if you have any questions, comments, leave them in the comment section or discussion. Yeah, hope to talk to you later.